For 10 years now, Singaporean retiree Leong Apoy has left his front door open every night. He's not expecting guests. It's in case he dies in his sleep and no one realizes. Mr. Leong's 81 years old and says he didn't think he'd live this long. Born in Malaysia, he came to Singapore when he was 12 years old. Unable to read or write, he's worked in a number of low-skilled jobs, including as a coolie, cleaner and store assistant.
我細個走出嚟係本手走出嚟嘅咧，喺蓮芳走出嚟嘅，邊個細路哥？而家佢啲人啲，你見到我喺面企喺面前，我都唔認得。我以前咧就冇諗到自己老咗咁慘嘅，係咪？諗到即係咁上下，預備死嘅啦，預備係咪？點知咁長命唔死得成，好燥自己爛賭，燥乜嘢咧？唔係。 口講一句，我係唔賭錢，我大把女，我就賭嘅壞晒自己後生嘅就。
Age has taken a toll on Mr. Leong's health. He suffers from kidney failure. Swollen legs and feet make it painful to walk, and he's often in and out of the hospital. According to the United Nations, globally 40% of older persons aged 60 and above live independently. And for many seniors with chronic health problems, living alone can be a real challenge. And that's why social relationships and communities like this play such a crucial role in keeping the elderly engaged and connected, so that for some, like Mr. Leong, living by oneself isn't so much a sentence, but a matter of independence.
咁自己嘅人自好啲，自己方便啲乜嘢，自己自由，唔使同人哋爭執。 乜嘢都係自己嘅，係咪？冇人鬥你，你俾得我自己去住啊？係啊，佢係俾1、200你啊，唔會。起身沖完涼食完嘢，落3樓做運動，坐喺度睇有冇嘢反啊，有冇捉棋啊，有冇捉棋冇啊？睇我做戲啊，有冇反嗰啲公仔啊嗰啲唔知啊？ 我都係食完飯我翻上嚟，翻上嚟我發現唔可以低下坐，嗰啲女人嗰啲鴨嗰啲嘴好似鴨咁樣執，我發現同佢哋坐，發現係咪？我自己走上嚟。
With the growing aging population in the region, Dr. Lee Keng Hock, president of the College of Family Physicians, says more elderly are ending up by themselves. They're usually single, divorced, widowed, childless, or estranged from their relatives. In South Korea, for instance, 74% of poverty-stricken elderly folk live alone. And according to Statistics Korea, more than half of unmarried elderly live in isolation. While here in Singapore, the elderly make up about 1/3 of one-person households. Compounding a person's psychological well-being are physical challenges. As health deteriorates over time, aged are more susceptible to infections and chronic diseases.
If they are living alone at a time when the needs are increasing, their ability to access healthcare actually drops because of the physical disability that they may have, the lack of social support, and the lack of financial resources. So we really need to reorganize our healthcare. We cannot just wait in our clinics or in our hospital for them to make their way to our clinics to seek help. We should develop resources that bring the nurses, the doctors, and the healthcare workers into the community and sometimes into the patient's home as well. We need to train doctors to a very high level of competency because most of these elderly will have multiple diseases requiring multiple specialists.
There's also the challenge of aftercare. Problems like frailty or forgetfulness can cause further complications once a patient leaves the hospital or clinic. Grassroots organizations offer befriender, food delivery, cleaning and home care services, but they could be better coordinated. Medical oncologist Dr. Ravindran Kanasvaran agrees that family physicians can enhance healthcare management for the elderly.
This model has been practiced in other countries where it's been done quite successfully, where everyone has their own family physician who's nearby in terms of proximity and can get assistance when they need without having to go to a tertiary center like an emergency department and where it's crowded and you've got to wait long periods of time even when it's not an emergency.
But would house calls increase the cost of healthcare?
Most people have this wrong concept that house call is expensive. But you got to ask yourself, it is expensive compared to what? If a house call in one afternoon can prevent a patient from deteriorating and getting admitted to a hospital for 5 days, 10 days, and then on top of that, his health can become irreversibly damaged as a result of this episode of decompensation.
For the old with potentially terminal diseases like cancer, living alone can be particularly frightening.
It's already difficult enough for an elderly person to be staying alone, but when you throw them a curveball like cancer, it really is something devastating. Because I think the first few things that come to mind will be, how long am I going to live? What symptoms am I going to have? Am I going to go through this by myself?
The patient's lack of social support also limits the kind of treatment he or she receives.
I'll recommend either their children or relative move in with them during that period of therapy, or they move into the domain or the house that their relative is in. If they don't have such support, then it becomes very challenging. Even if we activate services like Meals on Wheels or even some home help, but what happens at night? And these side effects, they don't just come in the morning. They can happen anytime. And some of it are oncologic emergencies that require very quick attention. And if they're not even fit enough to get that help or call for help, then they will be in trouble.
Not all who find themselves alone like Mr. Leong prefer it. They often become socially isolated and withdrawn.
This can make them feel very lonely. So from a psychological viewpoint, they can get depressed because now they have an illness. This illness may cause them to be physically impaired. And on top of that, they have no one to talk to about this as well. So it can lead to depression and in very severe circumstances, even suicidal ideation.
You'll find many of them actually lock themselves in a house and become sort of really like a prisoner in their own homes. The antidote for loneliness is social connectedness. That means we must encourage people to connect with the community, with their neighbors first, with their friends, with their relatives. And sometimes we need the community to reach out to those who are lonely and elderly as well.
Still, at least for one man, not all is lost to age. As long as Mr. Leong's breathing, he'll remain stoic about his aches and pains. And perhaps in the solitude of his flat, he'll relive his happiest memories as a young man, seated amongst his scattered belongings and a manual wheelchair that will stay untouched because he's become too weak to use it.